Assalamualaikum doctors. In this video I am discussing about homocystinuria. So the symptoms and sign of homocystinuria is that dislocation of the eye lens. Look the pictures. That is dislocation of the eye lens, that is down and outward. And there is nearsightedness, the glaucoma and the osteoporosis. So normally homocystinuria, it comes differential diagnosis of Marfan syndrome. How can we differentiate between homocystinuria and Marfan syndrome? Marfan syndrome is an autosomal dominant condition, chromosome number 15, where homocystinuria is autosomal recessive and chromosome number 21 is involved. And lens dislocation of Marfan is up and inward, where homocystinuria down and out. Marfan syndrome mentality is normal, homocystinuria is submental. Marfan syndrome faces is thin, long face, homocystinuria is non-specific. Marfan, they have joint hypermobility, and homocystinuria is multiple contractures. So when we examine the child, like other stations, it can become musculoskeletal come. If a tall child, but we find that hypermobility, we are giving Marfan syndrome. Homocystinuria, there is multiple contractures. And also mentality, submental in homocystinuria. And cardiac lesion present in Marfan, aortic regurgitation, mitral regurgitation, which is normal in homocystinuria, no cardiac lesions. In Marfan syndrome, bone is normal, but in homocystinuria, osteoporosis present. Marfan syndrome, urine is normal, but homocystinuria, increased homocysteine in urine. Lower limb in Marfan syndrome, pes planus, where homocystinuria is pes cavus. Marfan syndrome, blood platelet dysfunctions. In homocystinuria, there is thromboembolic complications. So for homocystinuria, what investigation we run? First of all, diagnosis, genetic diagnosis, and increased 24-hour homocysteine in urine. That is cystathionine beta synthetase deficiency. Levis coagulation profile, increased tendency of thrombosis. Multiple thrombosis may affect the kidney. Renal function test we do. And imaging and ultrasound of the abdomen we are doing. MRI of the brain if needed, because hemiplegia can develop. DEXA scan for osteoporosis plus slit lamp examination of the fundus for optic atrophy. So the investigation we can remember: diagnostic is genetic testing, 24-hour urinary homocysteine level. Lab, we do the coagulation profile. There is multiple thrombosis, tendency of thrombosis. Kidney, we do renal function test. Ultrasound of the abdomen we are doing. MRI of the brain if needed, because hemiplegia. And DEXA scan for osteoporosis, and plus slit lamp or fundus examination because optic atrophy present. I would like to complete my examination by doing the developmental assessment. Okay, I would like to ask the mother about if he goes to school or not school, type of school, history of any seizures, and behavioral abnormality. So we are asking the behavioral abnormality and seizures and doing developmental assessment. Management, what we give in homocystinuria: high dose of vitamin B6 if seizures and EEG. So high dose of vitamin B6. And if not responding, we if responding, we are giving folic acid, B6 and B12. If not responding, we are giving biotin. Diet low methionine, improve lens dislocations, seizures and learning problems, aspirin and statin. So we are giving vitamin B6, thiamine, riboflavin. Okay. Follow-up of homocysteine level in the fibrosis and ophthalmology DEXA scan. So homocysteine level in fibroblast, ophthalmology and DEXA scan. This is all about homocystinuria, which is a differential diagnosis of Marfan syndrome. Thank you.